Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
And good afternoon. Welcome to Community Conversations. As the intro stated, I am the CEO of Treasure Coast Community Health. If you're new in town, you might not know what that means because every community health center across the United States has a different name because we are all locally owned and have our independent boards. We're all nonprofits and we all take care of you from a primary care point of view. So we have doctors and mid-levels, nurse practitioners and physician assistants. We have dentists. Some community health centers like ours have behavioral health and pharmacy and optometry. So again, the convenience of one-stop shopping, trusted folks within the community. And we have expanded in the last couple of years, again, for no better reason than to provide better access for you, our customers. But as I've said on many occasions, we are not solo in town. We depend on a lot of other organizations as they depend on us. And so that is one of the things that truly makes Indian River County special. Another thing, though, that makes Indian River County special is the presence of our elected officials that are the trustees of our hospital tax district. And so to that end, I've invited Marybeth Cunningham, who is the chairperson again this year,
Yes,
for the trustees. So welcome.
thank you. It's a pleasure to be here.
Well, you know, I can't believe, as you said, you've been on the board for 9 years, and I've been part of Treasure Coast Community Health for more than that. And this is the first time that you have been present. And so I really feel honored, way overdue.
Way overdue.
Way overdue.
No, it's my honor to be here with you.
Well, you have done such phenomenal work, but like many candles under a bushel basket, not everyone has seen the light or understands the workings of that. So a few weeks ago, those of you that weren't present can access this on our Facebook page. We had Anne Marie Suriano, who's the executive director, and she talked about some of the things that affect our community members in terms of the way the district operates and helps the community. But I thought having you here, we would talk about that from maybe a 60,000 point of view, 60,000 feet. I'll get it out sooner or later.
A high point of view. High level.
Yes, a different way of looking at things in terms of perspective. So when I came to Florida, we didn't have a hospital tax district. When I arrived here, that was a brand new term. I'm sure it is to many others. Could you explain that a little bit?
Yes, so the hospital tax district, we are an independent taxing authority. So if you look on your little tax sheet when you get it, you'll see the Indian River County Hospital District on there. We set our with the tax levels, and it's for the purpose of taking care of healthcare in our community. It started being pretty focused on just the hospital and running the hospital, but we have broadened our perspective over the years to make sure that everybody has access to all their health needs, and keep trying to find out who needs that kind of help and at what level and everything else.
But not every county has a hospital taxing district, even in Florida, is that?
Oh, that's absolutely right. I think there's only 3 that are like us.
Wow.
But there are 30 hospital districts. In some cases, they actually run the hospital.
Okay, and for those of you that didn't study social studies here in the state of Florida, there's over 65 counties.
Right.
Just to keep things in perspective. It took me a while to figure that out.
Yeah, so it's a little less than half of the counties have something, a taxing district like ourselves.
And so you have 7 elected officials on there.
Yes, we have 7 elected officials. We do not get any pay. We are all volunteer. Okay. We are the only government agency that's elected that does not get paid.
Wow.
Yes.
That is significant because
Yes.
I know the hours that you all put in. You are under the sunshine.
We are under sunshine law.
But that's not to say that each of you individually doesn't do an awful lot on your own time. where
Right.
you're not in the public eye.
Right.
Okay.
Yeah, most of us are on other boards and participate in other community things too. But the hospital district, it
very
takes some
unique.
time, and it's very unique. Yeah.
Now, you mentioned the hospital. So, again, for the reference of folks that might be hearing about this whole conundrum in the first time, you're referring to Cleveland Clinic.
Cleveland Clinic,
River.
Indian River, absolutely.
Okay.
You know, it was 3 years ago. Boy, it seems hard time's flown. But 3 years ago, the hospital board and the hospital district board kind of looked out in the future and said, you know, we didn't think that a community hospital is sustainable over time.
Mm-hmm.
That's happening all over the country too.
There is.
And we looked at it and we said, we need to do something, okay, together to do that, which wasn't always popular at the time for the hospital board and the hospital district to work together on it. But we did, and we had a whole process, and we looked at a number of partners to be able to do this. Contrary to what a lot of people think, we did not sell the hospital. We leased the hospital to Cleveland Clinic and the property to Cleveland Clinic. They were chosen, and they're now running it.
How long is that lease?
It's about a 75-year lease.
Oh, okay.
So they plan on being here for a long time.
Well, I'm glad I clarified that.
Yeah, it's a long time.
It is. But again, it's a very important part of our community. As a smaller hospital than the tertiary cares, it can't offer certain services just by volume and expense, some of the specialty
Yeah,
things.
it was a combination of they could offer more services. They obviously have more experience and their broader experience in that. It was also the ability to negotiate with insurances. They have a lot more power than an individual community for reimbursement. Yeah. Okay. You know, it's fortuitous that we did this when we did do this because, you know, a year into Cleveland being here, COVID hit. And, you know, that was a very dramatic time, well, for everybody, but for hospitals, very difficult time. Okay. And there's no doubt in anybody's mind, our community hospital would not have survived.
Well, and even post-COVID, as we look at the workforce issues that all of us are struggling with, the ability to bring nursing staff in at the rates that we've heard, you're absolutely right. There's no community institution that fared that very well at all.
No. And that's pretty typical across the nation now. I mean, the amount of money that hospitals lost. But so being part of a larger system, they were able to absorb that and to be able to keep going and still take care of the people, the patients, and, you know, our community.
And part of the agreement, as I understood it, was that the funds that the hospital district had collected and paid in the past would cease transferring over to the hospital by the third year. Did that happen?
That did happen. Yeah, we on average paid them about $6 to $7 million a year for poverty type cases and charity care, that type of thing. And so we made a deal with them that we would take that down, give them some time to build it up. But yeah, we are no longer paying them for that. However, we do still pay for the Partners program, which is for women and babies. And we do also pay some into the intensive outpatient, which is a new thing for them and for the new program for them in the community. Right?
And very, very much needed in behavioral health. Having the ability to have children and young adults seen, which is their focus right now, up to 3 times a week, and working with their families is so much more than we could do as independent mental health providers. There's no
I
doubt
think
about
originally they thought that they would be at capacity within probably 9 to 12 months. Within 3 months, they were at capacity, and they have waiting lists to come in. So
yeah, the need is very great, without a doubt.
Yes.
Well, I'm going to have us do a short break.
Okay.
Word from our sponsors, and then we'll come back because I know once we get started on the next topic, we'll just keep going. So.
Okay.
Thank you.
Let's do it.
Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Create your restful retreat and save 50% now on all Tommy Bahama and Lexington Home during our winter sale and President's Day event now through February 28th at Sunshine Furniture. Sophisticated looks with a mix of contemporary, coastal, and Caribbean styles, Tommy Bahama Home offers everything you need for your personal paradise. At Sunshine Furniture, we have the largest selection of in-stock coastal and casual sofas, love seats, chairs, slipcover sofas, bedroom, dining, and occasional furniture from Four Seasons, Capri, Best, Bark Lounger, Hooker, Universal, and more. We're the outdoor furniture experts and have anything you need for your patio or lanai, including a gallery of Lloyd Flanders, Berlin Garden, Woodard, Pollywood, Brown Jordan, Windward, and Kingsley Bate. Sunshine Furniture, 1295 US 1 in Vero Beach next to Planet Fitness. Family owned and operated since 1991. Visit our website at sunshinefurniturecasual.com and don't forget to visit our outlet and sales store directly across the street.
Sunshine Furniture.
Revive Vero Beach, located next to Anytime Fitness on Oslo Road and 27th Avenue, has everything you need to look and feel your best, including hormone replacement therapy, stem cell therapy, sexual wellness, weight loss, laser aesthetics, hair, tattoo, and skin spot removal, Botox and fillers, cryotherapy, comprehensive blood work, and everybody's favorite ozone and IV therapy. Refresh, renew, and revitalize yourself at Revive today. Call 772-492-6607. A member of the iTex trading community. Your iTex dollars are welcome.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and I've been doing this radio show, as Marybeth and I were just talking about, for about 4 years, because it gives me an opportunity to help myself, my team, and the whole community learn about the wonderful things that are happening. It's always changing. There's always new information, and so I hope that if you enjoy this conversation, you'll tell others about it so that they too can learn just half an hour a week. So we're back to talking about the Hospital Tax District,
Right.
which Marybeth Cunningham is the chair of. And she's a very patient chair. And that's very necessary because, as we have observed, because it is those meetings are in the sunshine, having 7 elected officials, while they all have the common purpose of improving healthcare in our community,
Right.
And I'm not sure, that's why I wanted to take the break early. You guys recently re-looked at your mission and vision statements.
Right.
And I know that as I see new people come on, 2 or 3 each election, they have different pieces of understanding before they get there. They also have different experiences and expectations about how they can make their mark in I don't want to call it a pet project, an area that they'd like to influence in
Right.
a positive way.
Right.
And so somehow you make that all happen in a discussion every month. So kudos to you. But tell us about this mission and vision, the strategic planning that you all did in this past year.
Yeah, so like I said earlier, we've tried to broaden our perspective on who needs help and how you need help, and really move towards more preventative type activities and that type of thing. And are we moving the needle? Okay, are we getting better in the community? So a lot more data driven, and a lot more looking at what the real needs are. As you know, you do a community needs assessment for health, as does the hospital and some other areas as well. But we never really go back and say, are we getting better? Are we really getting better? And
really, Florida is probably not I know it's not the number one data collection state.
No.
At a state level, much less at the local levels. It's kind of a patchwork of very good to very not good.
Right.
Very
Right.
poor. So that makes it even more challenging in terms of determining first the need, and then are we filling the need successfully, and should we do more or less of that type of thing? So what's the vision that came out of that discussion?
Well, I think that
it's always evolving. I didn't mean to put you on the spot.
No, it's always evolving. Like I said, we have three main focuses, okay? One is focusing on primary care, behavioral health, and maternal health, yes. Okay, that's one thing. Another thing is really looking at the prevention and what is out there, okay? That how do we make it easier for people to care about their own health and get early detection on things and early prognosis, okay? And baselines even. I mean, we encourage people, go see a doctor, get a baseline, know where your health is so that if you start feeling bad, you've got something to compare. And the third one is really fixing and trying to fill the blanks that we've got. That's where the intensive outpatient came from, which was really, it was funded through the United Way, through the community group,
the Community
Foundation, the hospital district, and Johns Island. Okay, so it's kind of unique in that way. We identified a need, and we got other partners to say, let's fund it, because the taxing district, we're always very sensitive to the tax level that, we're asking people to pay. So if we can work together with other partners, we're very focused right now on a detox center, a medical detox center. We have nothing in the county. And so how do we go about doing that, and who can go about doing that, and where should we go about doing it? So.
And for those that aren't cognizant of why we need a detox center, many of the medication-assisted programs for people who have substance use disorder require that whatever is in their system is flushed out. Right. So it's not a contraindication. And for some, like opioids, that detox is not all that difficult. It is if you're the person but from a medical standpoint, it can be arranged, and there can be other things that help in that transition. But someone who has had a history of alcohol abuse, who starts their day and just keeps the pump primed pretty regularly, week in and week out, medically that's a very difficult detox, and yet there's some real hope. There's really promising practices that take place if you start with a detox. And so we are seeing a lot of folks that we've been able to help. I think, not to brag, but we're one of a few that do substance use disorder treatments. And it is complex, but we're seeing a lot of really successful cases come out. People's lives are changing. And we're not doing this alone. We're working with the Substance Awareness Center and other Southeast Behavioral Health Network is helping with the financial support and some of the best practices in that. So I'm really encouraged about that, and I appreciate the fact that
so important right now. I mean, with COVID, we are just beginning to see some of the evidences of COVID and the isolation and like you said, more drinking, more alcoholism and that type of thing, because people that's how they dealt with the isolation.
Exactly.
So there's a very strong need in the community to do that. So,
but again, I would say I was surprised that when I came and heard that the hospital district statutorily could tax up to 5 mils, and then looked at the budget that was being presented that year, you guys aren't even at 1 mil. No. So truly great stewards of the money that's coming, and really wise about how do we best spend that as we go forward.
It's a balance of taking care of the community and yet not overtaxing. Since I've been on here, which is 9 years, the highest we had was a 0.99 mil, I believe, and we are down now in the 0.5 area.
Wow.
But we're providing more care and more funding to more agencies. when I got on here, we were funding 6 agencies. We are now funding, I think we're up to 21 agencies, and very different things. We fund a navigator at Hope for Families, which is the homeless family shelter. Okay. Because they come in, they generally don't have a doctor. They generally they have needs. Sometimes, they have behavioral issues and that type of thing, the children even. So having a navigator right there with them, working with them, is really important. Some may say, well, that really isn't part of your purview, but it very definitely is part.
Well, I can tell you how grateful we are at Treasure Coast Community Health on behalf of the 28,000 unduplicated patients we saw last year for your support, because without that, we certainly could not have done many of the programs that are unaffordable or that we get no money for. And again, I want to thank all of the philanthropists who do help support us, but there's no denying that the tax base helps us greatly. Through the hospital tax
Treasure
district.
Coast is a phenomenal agency. It really is, and the growth that you have had over the years is amazing in serving this community, and expansion into behavioral health, and expansion into optometry and dentistry and everything is just really amazing. And
thank you.
I hope people understand what a treasure they have in Treasure Coast.
Well, I think the stigma still carries on, to be perfectly honest. Many people think of us as a federal safety net, and they should. Okay, we won't turn anyone away that can't afford to pay. But the reality is that all of our staff are employed, including our providers. They're board certified. We hire for experience and heart. To me, that's an unbeatable combination that I want when I go. And so many, I won't say all, but because it's not a mandate, but many of our staff members and their families use our services because we give really good care. And the real icing on the cake is how interconnected it is. We use the same platform of software, so the medical record can be accessed if you need it to be. That means we adhere to all the privacy rules. We're HIPAA compliant. We respect people's privacy, but instead of having to tell 3 different people what medications you're on, depending on whether you see a medical provider, a dentist, or someone in behavioral health, that record is already there. And so with that as a starting point, then we can then talk to you about how can we make your health better from that basis without wasting time on that. And again, the convenience factor of putting multiple things in the same location with the same staff who get to know you, it's really important for us to have that. And just like all folks, we do have some turnover. But it's very, very limited, and usually limited to our front desk, because we give people the opportunity to have their first job with us. And things have changed over the years.
Yes, they have.
First jobs used to be at 15 or 16. Now our high school graduates are lucky in competing for those unskilled jobs. And so they learn by doing, and thank you for your patience is all I can say.
Well, it's a challenge these days. It really is.
It is. The workforce challenge is pretty high, but we are going to continue hiring, looking for additional space that will suit our customers' needs. And
this county needs you, and
thank you very much.
Need Treasure Coast here. So, and if anybody is listening and you don't have a primary care, call Treasure Coast. I'll take good care of you.
Well, thank you, Marybeth, and thank you so much for being here today.
Oh, it was great to be here.
You come
anytime.
You come on back.
I'll come on back.
And I hope the same could be said of you, our listening audience. Come on back next week. I'll have another very interesting guest for you, and I hope you have a nice evening. Bye-bye.